Dear Patriots, before the news starts, please subscribe to our patriotic channel by clicking the subscribe button. Give us a thumbs up to this video. Don't forget to leave your opinion below in the comments section. Share the news on Facebook and Twitter so you friends see it. Thank you.
Trump talks up death penalty, border wall and opioid speech. President Donald Trump on Monday formally called for using the death penalty to fight the nation's opioid crisis, overshadowing dozens of other administration proposals that had bipartisan support. "If we don't get tougher on drug dealers, we are wasting our time, and that toughness includes the death penalty," Trump said, one of 6 times he invoked the death penalty during remarks in New Hampshire, a state hit hard by the addiction crisis. The president's rhetoric was the administration's latest pivot on how it would, or wouldn't, seek the death penalty as part of its strategy to fight the opioid crisis. Earlier versions of Trump's plan had explicitly called for seeking the death penalty for some drug dealers, although senior White House officials on Sunday night said it would apply only to drug traffickers in certain cases, in line with current law. Trump also touted numerous public health measures that will require new spending from Congress, although it's unclear whether lawmakers will provide the money, or if will be enough to reverse an epidemic that killed 42,000 Americans in 2016. Democrats, who said Trump has been slow to respond to the epidemic, said they're still waiting to see if the administration will aggressively push lawmakers to add new funding. "On the one hand, I appreciate the attention to the epidemic," said Senator Maggie Hassan, DNH, "but those recommendations aren't going to do very much to pay for treatment and build a workforce to care for patients." White House counselor Kellyanne Conway told reporters that the administration is seeking the full $13 billion requested in the president's budget proposal earlier this year. One White House proposal, to expand Medicaid coverage for inpatient addiction treatment by lifting a decades-old restriction, could cost at least several $billions per year. "All of this is nothing but words on paper if we can't fund it," added former Representative Mary Bono, Republican California, co-founder of the Collaborative for Effective Prescription Opioid Policies. Trump's plan, when it comes to treatment and prevention, largely mirrors policies first developed during the Obama administration. It advocates for a nationwide database to monitor for patients who seek multiple opioid prescriptions, as well as making overdose reversal drugs more available to first responders. The White House also announced a new website, crisisnextdoor.gov, that encourages Americans to share their own personal experiences with addiction in hopes of lessening the stigma. Those ideas were widely hailed on Monday by advocacy groups. The National Association of County and City Health Officials supports a number of White House public health proposals, the group told reporters, highlighting policies to expand access to evidence-based treatment and expand Medicaid coverage. But public health experts and lawmakers worry Trump's harsh immigration rhetoric and focus on law enforcement measures will overshadow treatment and prevention measures that have bipartisan support. Trump reiterated his controversial calls to build a wall along the Mexico border and block funding for so-called sanctuary cities, framing them as key tactics to fight the nation's opioid epidemic. However, studies have found limited connection between immigration policy and opioid abuse. Even with a border wall, many law enforcement experts have said that traffickers would find other ways to get their drugs into the country. Trump also called out MS-13, contending the drug gang's violent tactics justified his tougher law enforcement approach. "They don't use guns," he said. "They would rather use knives because it's more painful and it takes longer." 90% of the heroin in America comes from our southern border, where eventually the Democrats will agree with us and build the wall to keep the damn drugs out, Trump said. He also called on Congress to make it easier to invoke the mandatory minimum sentence for drug traffickers who knowingly distribute illegal opioids that can be lethal, like fentanyl. Public health experts seized on Trump's harsh language around enforcement, contending the addiction crisis requires a focus on treatment and prevention. "They are treating this like a criminal epidemic as opposed to a public health epidemic," said former Representative Patrick Kennedy, who was a member of the president's opioid commission last year. He should be using his bully pulpit to send a clear message that the health system needs to change its stripes. Instead, Kennedy said, it's going to be a sideshow about who qualifies for the death penalty. Trump's speech, his first visit to New Hampshire as president, carried undeniable political intrigue, coming 3 weeks after formally announcing his 2020 re-election bid and as Republican rivals also visit the state, fueling possible talk of a GOP primary. I want to win this opioid battle. I don't want to leave at the end of 7 years and have these problems, okay? Trump said, alluding to his hope for a second term. A lot of voters in the room, I see that, he added. Even as Trump's remarks struck a partisan tone, the Hill's work on the issue has largely been across party lines. Key congressional committees this week are reviewing proposals for addressing the epidemic. Congress, meanwhile, is expected to soon announce plans on how it will spend an additional $6 billion to fight opioids that was approved last month. The opioid crisis is viewed by us at the White House as a nonpartisan problem searching for bipartisan solutions, Conway told reporters on Sunday. Conway is scheduled to have lunch with House Energy and Commerce Republicans on Wednesday to discuss the panel's opioid legislation. Trump on Monday was joined by HHS Secretary Alex Azar, Attorney General Jeff Sessions, and Homeland Security Secretary Kirstjen Nielsen, whose departments are largely responsible for executing the president's ambitious plan. Conspicuously absent at Trump's speech, Democrats. The state's 2 Democratic senators needed to stay in Washington for votes, their offices told Politico. Trump's visit also sparked local protests, with some demonstrators seizing on reports that Trump called New Hampshire a drug-infested den in a conversation with Mexico's president last year. There were more than 64,000 drug overdose deaths in 2016, mostly involving opioids, according to the most recent federal mortality data. The CDC this month reported that emergency rooms recorded a 30% spike in opioid overdoses last summer, indicating that the devastating crisis is worsening. Trump originally planned to put Cohn at CIA, but changed his mind. Former White House economic advisor Gary Cohn reached a tentative agreement with President Donald Trump to become his CIA director, but lost out on the role after Trump abruptly changed his mind. Cohn, who resigned in early March amid a fight over tariffs, told associates at the time that he would consider rejoining the administration if Trump called and offered him the right big job, but he did not elaborate on what that job would be. In fact, according to 3 people close to the president, Cohn had already talked with Trump about taking the helm of the CIA, a job that suddenly opened up last week when Trump nominated his spy chief, Mike Pompeo, to replace Rex Tillerson as Secretary of State. Trump, these people said, informally offered Cohn a position, telling him he thought he'd be a good fit for the job, and Cohn had agreed to take it. Trump long ago decided that Pompeo would replace Tillerson as Secretary of State, and the president in recent weeks had bounced off his closest external advisors the idea of sending Cohn to the CIA. It is unclear why Trump decided to change course at the last minute, but last week he named Pompeo's deputy Gina Haspel to the CIA role instead. 2 senior administration officials acknowledged that Trump discussed other positions with Cohn. But they did not specify any other position, and they said the president didn't extend a formal offer. Trump made clear his desire for Cohn to return in his public remarks about the departure of the former Goldman Sachs executive, a Democrat who served Trump as director of the National Economic Council. In his final public goodbye, Trump said of Cohn, he's going to go out, make another couple $100 million, and then he's going to maybe come back. You're going to come back, right? The president asked. The episode offers a window into Trump's decision-making a little more than a year into his tenure. While he is growing more comfortable in the job, willing to follow his instincts and make unorthodox personnel choices, his decisions remain entirely unpredictable, leaving even his most senior advisors in a state of perpetual uncertainty. Cohn has no background in intelligence but told associates he was interested in running the CIA or, potentially, serving as Secretary of State. He was at one point the leading candidate to be chair of the Federal Reserve, but his standing cooled after he criticized the president's equivocal response to a white supremacist march in Charlottesville, Virginia, last year. Cohn has had multiple inquiries by private sector companies, but he has not lined up his next job. Cohn's near miss at the CIA came amid turmoil across the administration. The president remains unhappy with David Shulkin, his Secretary of Veterans Affairs, and Ben Carson, the Secretary of Housing and Urban Development. He announced last week that Larry Kudlow, the CNBC commentator and former Reagan economic advisor, would replace Cohn at the National Economic Council. Cohn and the president began discussing other possible senior jobs in the administration when the NEC chair told Trump 2 months ago about his plans to resign, according to the two senior White House officials. Those discussions never reached the point of a formal offer, these people said, and Cohn announced on March 6 that he would leave the White House. After the White House announced Cohn's resignation, the president and Cohn continued having substantial discussions about other positions, the officials said. The officials declined to say which jobs were discussed and would not confirm or deny that the job as CIA director was one of the possibilities. On March 13, Trump announced that he would nominate Pompeo, a former Kansas congressman, to replace Tillerson. He tapped Haspel, who has been with the CIA since 1985, to replace Pompeo as head of the spy agency. One senior official said that while discussions between Cohn and Trump have not yet worked out, the former Goldman president may still rejoin the administration at some point. As the president made clear, he and Gary continued to have a strong relationship and Gary could eventually return to serve in another senior role in the administration, the official said. This is Gary Cohn's last meeting of the cabinet, with the cabinet, and he's been terrific, Trump said in his farewell to his NEC director. He may be a globalist, but I still like him. He's seriously a globalist, there's no question. But you know what? In his own way he's a nationalist because he loves this country.